So thank you all. So just as give you all a sense of where we are at NPSC and what we're trying to accomplish here. So as you all know, NPSC is composed of three sort of main committees and two work groups. And the two work groups reflect our big priority areas. There's a poverty working group and a violence reduction working group, and of course, the violence reduction working group. And we're interested in having these calls to hear from scholars in the field to tell us either about new work that they have ongoing that they think is important to get into the policy narrative, or to tell us a perspective that perhaps is different from mainstream consensus that will get us thinking about different ways to approach chronic problems. We are fortunate enough today to have Jeff Butts join us. And Jeff, I think, if I understand his presentation correctly, is going to do a little bit of both of those things. Violence reduction using all available tools, I guess, is his talk. So I have had the great fortune of knowing Jeff for more than 20 years. We first met at the Urban Institute in Washington, D.C. on what was my first day there. Jeff did his graduate work in social work and sociology at Michigan, and before that actually was a working social worker for several years. And after Michigan, he went to National Center for Juvenile Justice in Pittsburgh for 6 years in the 90s until we poached him at Urban, where he ran the program on youth justice for many years before moving to Chapin Hall at the University of Chicago as a research fellow, and since 2010 has been the director of the Research and Evaluation Center at John Jay College in New York City. I can't begin to go through all the research that Jeff has engaged in because he has touched just about every issue that's important around juvenile justice and what I think of as the causes and correlates. And so everything from big policy questions about what age juveniles should be legally allowed to enter the adult system and thus not be eligible for the juvenile system, to questions about violence reduction around focused deterrence and cure violence. So Jeff is going to talk today, as I understand it, a little bit about the Cure Violence program in New York City, which I'll leave to him to explain, and a little bit about a topic that I sort of nudged him towards, and which I hope is okay, which is that I think that there is, in the juvenile justice world in particular, there's a little bit of a lack of alignment between those who believe that we should continue to move strongly toward an evidence-based perspective and focus on funding, fielding, implementing, scaling programs with a demonstrated evidence base, and people who believe that many of the best programs are very difficult to evaluate in a strict sort of randomized control kind of way, things that focus on positive youth development and cultural competency and participatory approaches that by their very nature aren't particularly amenable to strict evaluation, and thus we miss some opportunities if we focus narrowly on an evidence-based perspective. And so I asked Jeff just to talk about, since he's been on both sides of that divide as an evaluator and a policy analyst, where he thinks some cohesion and consensus may lie. So that's my introduction. Jeff, let me turn it over to you.
Okay. So I'm going to talk about our evaluation of cure violence. So the title that I gave you folks was something like use all the tools. And that's because I think when policymakers, elected officials, and the public hear the words violence, especially gun violence, they immediately think about law enforcement, policing, and all kinds of variations of policing. And anything other than that seems to some like a pipe dream or something in the far future. I've had this conversation before with, for example, Thomas Abt, who was at DOJ and now he's at Harvard, and he wrote a book some of you may know called Bleeding Out. And I accused him of claiming trying to claim the high moral ground by naming the book Bleeding Out and saying, basically, yes, fine, of course violence is correlated with poverty and disadvantage and housing problems and unemployment and all the other social ills of America, but we don't have time to wait for that. We have to do something now. And his do something now is mostly a combination of better policing with a good dash of cognitive behavioral therapy thrown in. And I find that to be probably the normative response of policy, people in the policy world, policymakers, elected officials. Most people do acknowledge that violence varies by community, varies by social context, and they think that is something impossible to address. And so we have to go after the people now behaving violent, which I always summarize is getting better and better at finding out who the bad people are and where they are and controlling their behavior. But whenever I teach, especially younger students, I remind them of the heritage of sociology and the studies of suicide, for example. In the 1800s, people thought suicide was a symptom of individual dysfunction and problems within a person. And then with the advent of public health data, we started to learn that actually suicide varies socially as well, by social context. So how could that be? And what does that mean for intervention? And I think in violence right now, it's a little bit easier to sell the concept to an elected official that violence varies by community, and it can't just be, the explanation can't be the fact that people prone to violence all chose to live in one neighborhood. It's more likely that social contexts affect individual behavior. There's an interface there, and I think all of us know that. But what does that mean for intervention, and how do we address this? So along comes a brand. It started out being called the Chicago ceasefire model. Gary Slutkin in Chicago. Now it's, and I also, they were based at the University of Illinois at Chicago, the School of either Medicine or Public Health, I forget. They are now spinning off and becoming a 501c3, I imagine. And the name is Cure Violence. We were asked by the Robert Wood Johnson Foundation about 4 years ago to, no more than that, 6 or 7 years ago, to start looking at the Cure Violence model. At the time, working with Dr. Katerina Roman, who some of you may know well. And we started to focus on how to evaluate this model. And the first thing we discover is what I was calling at the time brand battles. It is true that the dominant model that is even promoted from my own institution, John Jay College, the focused deterrence approach that people associate with David Kennedy, has a lot of elements that they share with Cure Violence. I assume that people can read the small print, but if you think about street outreach, a traditional approach to supportive services, legal help, housing, employment, those are in both models. The things that are different are on the right side there. Focused deterrence uses targeted enforcement, offender call-in. So they basically do analyses to find out who the most active either group members, cliques, crews, gangs, or people like Andy Papachristos has been doing work on using social network analysis to identify the people most probably involved in violence as a victim, because their social networks are filled with people who are known to carry handguns and resort to violence. But it's basically what I said before, like who the bad people are, getting better at identifying them, predicting them, and approaching them early. And if they don't cooperate, using the justice system to go after them. So you have, and you can find these videos online of the crew from a focused deterrence approach, walking up on the front porch of a home, knocking on the door, asking to speak to the 19-year-old who lives there, and letting that person know that the police department is well aware of who they are. They've collected video, they have photographs, they have enough evidence to pursue prosecution, but we don't want you to do that, is the message. We want you to live a different way. Are you willing to work with us? We can connect you to the job. We can get you back into that community college you tried. The whole idea is face-to-face, individualized deterrence. On the other end of the spectrum, the thing that's different about Cure Violence is it acknowledges that it's called the public health approach because it acknowledges that these behaviors vary by community and also vary by situation. There's a big overlap between the public health approach to violence reduction and what people in criminology call situational crime prevention. And I attempted to write a cute blog about this last year, where I analogized the public health approach and the law enforcement approach as what it's like to board an Amtrak train in DC versus New York. And I said that New York, the environment is chaotic. No one knows where they're supposed to be until the last minute. Everyone panics and runs to their gate. It's noisy, it's crowded. People behave badly. They bang into each other. They cut in line. People yell at the people cutting in line. It breeds social disorder. And it's the environment, because the same people boarding a train in DC know earlier where their gates are. They know where to line up. There are those back and forth rope cattle call things where you know when you show up at your gate that there are 20 people in front of you, and you relax and you get in line, and you know that the people coming along after you will also be getting in line, and no one's going to be shoving in front of you and getting the best seats. And so people just tend to relax and behave themselves. And that's not because people are better in DC than in New York. It's because the environment, the structure, the situation encourages pro-social behavior as opposed to antisocial. And then the other thing, so the two things there in the red box are Cure Violence uses that as its governing theory of how to prevent violence. And it hires people, here called credible messengers. They're called violence interrupters in offices that are doing Cure Violence. And those people are from the community. They're called credible because they have, as they say, lived the life. They've either been in a gang, they've done time, they're now home. And the typical employee of a violence interrupter staff in a Cure Violence office would be, say, 35 or 40 years old, home from incarceration, out in the neighborhood, trying to connect with the 14, 15, 16, up through early 20s, people in the neighborhood who are thought to be involved in street crews and cliques, and they make friends with them. They develop trust. They don't work 9 to 5. You'll find them out in the park at 10 p.m. hanging out and talking to people. And in doing that, they're accomplishing two things. They're creating social bonds with those people, with the people most likely to be involved in street violence. And they're learning about future events. So when people trust them, they will hear things like the H Street crew is really going to go after the Fulton Avenue crew, and it's getting bad and it's going to get rough. And they hear that, and they approach both of those groups and try to talk them out of using violence and say, what's the beef, basically? What's your conflict? What's the complaint? Who are you mad at? And they try to intervene. And you can find lots of videos of this process. That introduces both a wonderful asset of Cure Violence programs and a huge risk. That and the joke I make sometimes with the idea is you want to hire a credible messenger who once lived in the life. The problem is you don't know that it's all past tense. So someone may be home from incarceration and they may still be maintaining contacts with active members of that crew. They may be doing illegal things and they are not entirely out of it. That's not a common thing, but every office is at risk of one mistake. And we've had experience with that here in New York, where some staff member makes a mistake or breaks the law or is caught with a weapon on them. And cities and elected officials respond to that by often pulling the contract, shutting down the whole program, disparaging the reputation of the program. It's a real problem. And of course, no other social institution is perfect, and mistakes happen and errors and unwarranted or unwanted events happen. But these programs are more likely to be accused of being having a negative influence in the community inherently, and they can risk losing all the funding, and political officials run for cover. The other thing, and finally, the other thing in this red box is the Cure Violence programs attempt to shape social norms through public messaging and events. They do post-shooting responses, they do billboards and posters, and they try to establish, they use the analogy of cigarette smoking. Young people today would never think of lighting up a tobacco cigarette on an airplane or a restaurant, and yet when I was their age, that was common and it was everywhere. And that's not because everyone decided to change their behavior, it's because of sustained effort to change social norms around smoking. So they try to do that with violence as well, to make violence not an appealing behavior. So anyway, so the basic description here is using the situational crime prevention, social norms, and public health approach to try to reset what's normal about violence, as opposed to using what is very expensive. The focused deterrence model, they may, people who believe in that will concentrate on street outreach and everything, but you have to have access to the justice system. So the courts, police, prosecution, incarceration, state, federal, prisons, all have to be available to that model to work because they have to back up that threat if someone fails to comply. And you have to include the cost of that whole system and the cost of that model. The people who run that model, and I've had this conversation with David Kennedy, he does not like to consider all that what he thinks as sunk cost or existing infrastructure as part of his model. But you have to think about the cost of that. A cure violence program in New York, we now have about 20 of them. Each office might run on $500,000. NYPD's annual budget is $6 billion with a B. So you don't have to prevent a lot of shootings for $500,000 to be cost effective. And that's an issue we are about to explore with our friend and colleague, John Roman, to do some cost benefit, maybe that's not the right term, but using cost of social harms resulting from shootings and using those as the metric with which to judge the efficiency and effectiveness of cure violence programs. So I said they're all over the city right now. There's about 20 of them, soon to be more. We got funding from Robert Wood Johnson to look at 2 programs before they opened, which was unique. Most of these evaluations are done post hoc. We got funding to look at the new site in Bed-Stuy, Brooklyn, and a new site in Morrisania in the Bronx. And those dark blue polygons right there are where the programs are, and the light blues are the statistically matched comparison neighborhoods that we selected. So each of the intervention areas had 2 matched comparison zones. And we did multiple data collection. We looked at, of course, police data on shootings and homicides. We also got hospital data. So we know every case, every person who presented to a medical facility, hospital, or emergency department with an injury due to violence, and looked and separated them out and looked at the gun violence injuries. And it's a billing system where that data comes from. So we know the payment source for all those patients. And we know the address where the patient was living at the time of their injury. So that's a tremendous data source because it's around since the 1990s, it's consistent, it's reliable, and we could look at changes in the probability of someone being hurt by gunfire in a neighborhood with cure violence and compare that to a matched neighborhood without cure violence. And the matching criteria included prior incidents of violence, crime rate, concentrated disadvantage, everything you'd want basically as a social indicator. And then we followed them up. So treatment and comparison zones. Okay. The city cited these programs. The little dark blue polygons are where the programs were located. And this is from 5 years ago. So they've grown more since then. But you can see that the city placed the programs where they needed to be. So the red areas are where there were high clusters of gun injuries, and that's where the programs ended up, which introduces a problem, an analytical problem, because when you do that, you're basically allowing all the programs to all join in on the fun of benefiting from the slide of regression to the mean. So the fact that we have comparison zones, though, helps, because shootings were coming down everywhere in New York, but the analytic question was, do shootings come down more in a neighborhood which is either wholly contained within a catchment area for cure violence or adjacent to it, so that we have geographic data for all these incidents and we can cluster them around the cure violence and create a buffer of 300 feet or 500 feet, whatever we choose. So that was really helpful for analysis. So we found some encouraging things. When you look at gun injuries on the top, shooting victimizations on the bottom, in New York, a shooting victimization is someone hit by gunfire, not just an attempted shooting, it's actually a victim. And you can see that some of the comparisons were strong and some of them were near, like the shooting victimizations in the East New York site down below on the left was a draw between the East New York cure violence site and the comparison zone in Flatbush. Others were very strong. Look at the comparison in South Bronx, shooting victimizations on the lower right, dropped 63%, and the comparison zone just 17%. Upper left were gun injuries, that's the hospital data. Gun injuries in East New York, where the cure violence zones had the advantage of a 50% drop compared to a 5% drop. And we are still working with this data. It's really curious to see that in general, The hospital data, which reflects gun injuries of the patient coded to where the patient lived at the time, sometimes have stronger outcomes than shooting victimizations. So the shooting victimizations are coded geographically according to where the shooting happened. So in essence, Cure Violence may do a better job at reducing the incidence of violence among people who live in the neighborhood than it does reducing the incidence of violence itself in the neighborhood, which is an interesting and perhaps curious finding. Other things though, in general, these are declines in gun injury rates before and after the program opens, so a little pre-post. And you can see the advantage generally fell to the Cure Violence site compared to the match comparison areas. Those are 4 neighborhoods. So each one had, again, a matched statistical area. The last thing we did, or actually the first thing we did, but a very important thing, was we, instead of just relying on administrative data, we did street interviews with young men ages 18 to 30. This graphic tells you that we used respondent-driven sampling, if any of you know what that is. The top dot there is the initial respondent. You walk up to a person in a neighborhood and say, would you be willing to talk to us? Are you between 18 and 30? Can you prove that you live in this neighborhood? They would hold up a driver's license. We would tell them to cover their name with their thumb. It was all anonymous, but we would confirm the street address was valid. And then each of those people refers up to 3 more people. So very quickly that network tree grows and we end up with a good, it's not as representative obviously as a probability-based residential survey, but it's cheap. You get at a population that's hard to get at through a regular probability household sample because it's only males, it's only 18 to 30, and they have to live in the neighborhood. And then we ask them a whole series of questions. One of the key elements in that survey was we asked them 16 scenarios, behavioral scenarios, in this potentially conflictual circumstance. How far would you take this confrontation? Would you ignore it? Would you react verbally? Would you get physical? Would you pull a weapon? Would you use a weapon? And that scale goes to 10. And then we had an 11th code, which was when the respondents, we did this on handheld tablets and allowed the respondents to slide the bar themselves if they wanted. And when a respondent slid the bar all the way over as far as they could to the right, we gave that an 11. And we did 16 scenarios and then created scales. So you can see from these 16 scenarios, it's a range of things from trivial, or what we call petty disputes, to more serious disputes that involved often sexual relationships and pride and turf and respect. Some of the ones that got the highest responses on being willing to turn violent were things like the second one from the bottom there under the first category. Someone shows up at a party wearing the jacket everyone knows he took from you. So that addresses public shame and public embarrassment of someone. Anyway, so we use all these, use factor analysis and turn them into 2 scales, petty and serious disputes. And that just gives you a sense of what the screen looked like as they were answering the questions. The respondent themselves could either verbally tell us their answer or slide that bar to the appropriate position. This is what we found, that there was a definite difference in the difference. When you look at the comparison areas, we did the same survey in the exact same way with the same crew of people. And there was a not overwhelmingly positive difference, but a defensible, statistically significant difference in the advantage of Cure Violence in terms of bringing down the support for the use of violence, more so than you would expect from the trend in the comparison area. So that's petty. And serious disputes was a bit bigger. So we found this to be encouraging, and this summary I gave people was, there's something here, there seems to be an effect measured either by actual shootings and gun injuries or the attitudes and responses you get from young men just hanging out in the neighborhood, that there's some value here. Then we also asked questions though about their view of police, and we did a special little publication on this because I wanted police officials to know this. Sometimes I would meet with a police official and they would immediately say, oh yeah, Cure Violence, that ceasefire program, they're anti-police. And I would say, yes, certainly some employees of that program could say things that are anti-police, but the program itself is not. In fact, the best programs collaborate with police, not on the street, not in front of the neighborhood, but back at the precinct, back at the headquarters. They share information. They don't, what they might call snitch people. They don't give names of people, but they would say this group and that group are tending to be at each other, you should increase your patrol presence in that neighborhood for a while. So they do provide sometimes intelligence, but not specific case intelligence, which can annoy police officials if they think someone out there knows about a shooting that's about to happen and they're left out of it or they don't know. Anyway, so we asked these questions about, from the same respondents, if you heard violence was breaking out in your neighborhood, could you count on the, can you and your neighbors count on the police to help? And you'll see there was a slight advantage there in the cure violence neighborhood. So over that period, young men living in a neighborhood with a strong cure violence program tended to increase their level of trust in the police. And the same thing, if you saw someone being beaten up or shot, would you call the police to report the crime? And in that graph, this is a difference in difference. The cure violence areas actually overtook the comparison zones a little bit. So not definitive, maybe not even powerful, but something is there. And the question we still have, and I mentioned before, working with John on this, is how many shootings do you have to reduce in a neighborhood to pay for that program? And from preliminary work we're doing and from some of the economic estimates of the harms, just medical costs and other social harms, it looks like in a neighborhood the size of Red Hook, Brooklyn, a neighborhood might hold 20,000 people. If you could reduce the shooting by 1 or 2, you've paid for the program. So I always tell people this is not the solution to violence, and it's no magic. It's not a magical solution, but it certainly should be considered as one of the in the repertoire of a neighborhood. And if the police department in a city can learn to cooperate honestly, openly, but in a supportive way with the Cure Violence program, it could be a pretty powerful thing. I leave that website there because we did a conference a couple years ago and posted all the materials from the conference, as well as a bunch of videos and presentations describing the research, describing the model. We had a lot of employees of Cure Violence programs talking about how they do their work and what it's like. And all those videos are available on that website. And if you're interested in this model or want to know more about it, I encourage you to go there. And I'm always willing to take calls and emails from people who are interested and want to know more. I think that is the end. So I thank you and look forward to the discussion.